Welcome back. It's now more important than ever to keep your health in check amid the pandemic. Dr. Francisco Lamoglia from St. Joseph Medical Center explains.
Generally, COVID infection causes widespread inflammation, and with the widespread inflammation, it causes tissue damage. And when tissue gets damaged, you can have arrhythmias, you can have heart failure, you can have heart attacks, you can have many different symptoms that are typical of heart disease because it involves tissue death. The population that is most susceptible is the older individuals. Individuals 60 or greater, which is not that old, can get it, but if you're over 80, you have a higher risk of having severe illness. But the young get it also. COVID is not discriminatory. And depending on what your comorbidities are, your risk of having a severe infection increases. In age over 60 to 80 years of age, diabetes, high blood pressure, coronary artery disease, lung disease, cancer, all these can increase your likelihood of having a severe infection. The symptoms that we see are related to the tissue death. And those are symptoms that are very typical of heart disease. You can have chest pains, you can have palpitations, you can have lightheadedness, you can have difficulty breathing when you lay down, you can have difficulty breathing without laying down, you can have fluid retention. The interesting thing about it is that aside from the typical COVID symptoms that we look for, the fever and cough, the loss of smell and taste, the malaise and generalized weakness that occurs at about 1 to 14 days after exposure, cardiac symptoms usually come on after that. Patients should really seek medical advice anytime any of those symptoms occur. Any development of those symptoms I just mentioned, the shortness of breath, the chest pain, because it's not just COVID. A thing that we've seen over this quarantine is that patients have not come to the doctor to see medical attention and to seek medical attention because they're afraid of catching COVID, but they're having more heart attacks, more strokes, etc. And so anytime that there is a development of those symptoms, they should seek at least an opinion from their provider. Basically, as a patient, one needs to be aware of be able to identify whether they've been infected or not, and then be very careful, because if you're a young person, it's not likely that you're going to have a severe illness, but your father, your grandfather they might have issues. But if you're young and have any of these comorbidities, you can also get a severe infection that could lead to death. We need to understand that the COVID is a virus that is easily transmissible for the following reason. There's never been immunity to it before. It's brand new. And it's very easily transmitted in droplets. So facial coverings, hand washing, and distancing. Not social distancing, but positional distancing. We've seen an increase in psychiatric issues when people that become socially isolated. We need that interactions as human beings. We just need to make sure we do it far enough apart that it's safe.
Great tips there. For more information on how to keep you and your family healthy, go to stjosephkc.com.